What's going on, guys? It's Jimmy here. We got some major news for you in this video. Medicare is going to be running on a completely different model here for tens of millions of Americans. We'll go over the details of it here in this video. Also, healthcare is going to be skyrocketing in price by up to 75% here in the next coming months here, and I'll give you the details on why. We'll go over that here in this video as well. Also, President Donald Trump is going to try to lower prescription drug prices. I'll show you how. This comes after he reversed a previous ruling set forward by the Biden administration. So we'll go over that here in this video as well. So we got a lot of news here for you guys in this video. So let's jump right in. We are live right now here on the YouTube It's Jimmy Show. Let me know if you can see and hear me. Type yes in the chat. Let me know where you're tuning in from. You can let me know your city, state, or even your country, as we have people tuning in here from all around the globe. Don't forget to hit that like button for me here. And if you haven't yet, subscribe down below so you don't miss out on future videos and help me reach 500,000 subscribers. You guys are amazing. Let's jump right in. We got a lot to cover here for you. Okay, first up, map shows 6 states that are going to be testing a whole new Medicare model in 2026. So this is concerning for a lot of people, whether you're even on Medicare yet or you will be in the future, because this is a concerning trend and change. 6 states will be testing a new model developed by the Centers for Medicare and Medicaid Services for the federal health program, coming here soon in just a few months in 2026. At the end of June, the CMS centers announced a new model, which came as part of the agency's bid of what they're calling to protect both Medicare beneficiaries and federal taxpayers from, yeah, you guessed it, unnecessarily fraud, waste, and abuse. The states that were selected to test the new models include New Jersey, Ohio, Oklahoma, Texas, Arizona, and Washington State. These states did not choose to participate in the model, but they were instead chosen or forced to participate. And more states may be coming here in the near future. Yeah, so this model is being brought to reduce, quote, wasteful care, including services that provide little to no clinical benefit, which they will decide, which it added not only increased costs, but also puts patients at risk. The agency reports that waste in healthcare represents up to 25% of healthcare spending in the U.S., which estimates could be as high as close to $6 billion in spending as of 2022 with, quote, minimal benefit. The aim of the model is to reduce spending by cutting back on wasteful care. Some experts have voiced concern that the model may see necessarily treatment being denied, so something that your doctor says you need may actually be denied because Medicare or Medicaid actually doesn't want to pay for it, and they may deem it as wasteful care. Are you now seeing the writing on the wall? Yeah. Potentially harming health outcomes for Medicare patients. The model will bring in a prior authorization process. That's right. Relative to Medicare's existing processes, meaning recipients will either have to submit prior authorization requests for selected services or their claim will be subject to prepayment medical review. Yeah. But the model does not change Medicare coverage or payment criteria, well, except for the whole prior authorization processes, which is a big thing. Also, enhanced technologies, including AI, artificial intelligence, will be used to see if they can speed up prior authorization processes, which also could mean AI could deny the health claim or health process that your doctor deemed that you needed. And this is just the start of this. I will keep you up to date here. Let me know your thoughts here in the comments section. Real quick, if you're about protecting your health and your wallet, listen up. Millions of Americans are on the wrong Medicare plan. Many are paying more than they should, and others don't have the coverage they need. Some end up with unexpected bills that they can't delay. It's really sad. If you're about to turn 65 or already on Medicare, don't let this happen to you. Call my partners at Chapter with the phone number here on the screen. They'll check to see if you're already on the best plan. If you are, they'll tell you, and if you're not, they'll help you get something better. Folks that work with Chapter typically save $1,100 per year. That's right. It's free, it's easy, it's quick, and they can review your options in under 20 minutes. Make sure you have the right plan that covers you in an emergency. Call Chapter right now with this number on the screen, which is 833-700-1320. And it's 100% free. Don't just wonder or worry if you have the coverage you need. Call them today. Or click the link in the pinned comment down below and find out, like so many of our viewers have. Next up, healthcare insurance could be going up by 75% or more or less, somewhere around there, for tens of millions of Americans here very, very soon. Take a listen.
Now to a serious concern for the more than 24 million Americans who get their health care through the Affordable Care Act, also known as Obamacare. According to an analysis by the research group KFF, people who buy insurance on healthcare.gov or state-based marketplaces could see the price they pay increase by an average of 75% starting in January 2026. Insurers point to the growing costs of healthcare in general and new policy changes by the Trump administration, including potential tariffs. But a big part of the equation is also the expiration of enhanced premium tax credits for ACA enrollees that are set to expire at the end of this year. While Congress could act to extend these credits, there are no signs that Republicans in either the House or the Senate plan to take this up, and it could lead to the largest hike in ACA premiums in 7 years. For more, we want to bring in Cynthia Cox, Vice President and Director of the ACA program at KFF. Cynthia, welcome in. It is good to have you. Explain to us why these credits are set to expire, exactly what they are, and what could happen if they do.
So these enhanced tax credits are extra financial help for people to buy their health insurance on the Obamacare or the ACA markets. They've been in place for 5 years, but when Congress passed them, they made them temporary. So if Congress doesn't act to extend them before the end of this year, then they're set to expire. And what that's going to mean is that people, in many cases, will still get some financial help, but they're going to lose out on a lot of the help that they're getting right now. And that's why they're going to pay about 75% more on average.
So I think there was some confusion amongst those I saw talking about this online. There was this assumption by some that this was connected to that Trump mega bill, what the White House branded the so-called, quote unquote, one big beautiful bill. But in fact, it's somewhat of a separate issue because it wasn't included in that bill one way or the other that Congress is going to have to hopefully take up by the end of the year.
That's exactly right. So these enhanced tax credits would have expired at the end of the year, as long as Congress didn't do anything. Well, Congress did not do anything as part of the big beautiful bill to extend those tax credits. They still could do something. There's still time to do that. But because they didn't do it as part of the big beautiful bill package, now people who want to see these tax credits extended are getting concerned that there might be less time to do that in time to prevent these premium increases.
And look, in my day job, when I'm not here, I cover Capitol Hill for ABC News, and I've talked to Republican spending hawks who will tell you that they just believe these tax credits simply cost too much money at a time that they're trying to trim the federal budget. But if these tax credits do expire, and we see premiums jump by 75%, as your analysis shows would happen, what would be the broader impact of that?
Yeah, so it's going to have ripple effects throughout the health insurance system and the healthcare system more broadly too. And so what we're expecting is that if these tax credits are not extended, which are expensive and they would cost maybe $30 billion or more per year to do that. But if they're allowed to expire, then what we're expecting is that millions of people are going to lose their health insurance. What that means is that it's probably going to be healthier people who take the risk and drop their coverage while sicker people stay in the market. That's why health insurers are saying, well, we might have to raise our premiums even more than we otherwise would have because we're going to have sicker people signed up for our coverage. And then on top of that, when you have more uninsured people, they still need to get health care. They might go to the emergency room, and then hospitals are stuck with the bill. And so hospitals are also concerned about having uncompensated care and maybe even having to find other ways to pay for that, like shifting costs to other people.
Also, President Donald Trump says he asked 17 major pharmaceutical drug makers to take steps to cut U.S. pharmaceutical and medicine prices within 60 days. On Truth Social, Trump posted individual letters he sent to 17 drug makers. This comes after he signed an executive order reviving a controversial policy that aims to slash drug costs by tying the prices to some medicines in the U.S. to significantly lower prices abroad. He sent the letter to 17 drug makers: AbbVie, Amgen, AstraZeneca, Boehringer, Ingelheim, Bristol Myers Squibb, Eli Lilly, EMD Sereno, Genentech, Gilead, GSK, Johnson & Johnson, Merck, Novartis, Novo Nordisk, Pfizer, Regeneron, and Sanofi. The letters come after President Donald Trump signed an executive order reviving a controversial plan known as the Most Favored Nation policy that aims to slash drug costs by tying the prices of some medicines in the U.S. to significantly lower ones abroad. It was Trump's latest effort to try to rein in U.S. prescription drug prices, which are 2 to 3 times higher on average than those in other developed nations and up to 10 times more in certain countries, according to the RAND Corp, a public policy think tank. That the Biden administration also did. You can also see here that Trump ends push to slash prescription drug costs. President Donald Trump's pushes effort to end decreased cost of prescription drugs. With a sweep of the pen, President Donald Trump has ended a Biden administration effort to lower the cost of drugs for people on Medicare and Medicaid. President Donald Trump's order months ago, signed shortly after his inauguration day, targets policies his administration calls deeply unpopular and radical, because the Biden administration did it. One of those now canceled policies directed Medicare to investigate ways to slash drug costs, including the possibility of a $2 monthly out-of-pocket cap on some generic medications like insulin. This action also followed through on a key goal of Trump's first term, weakening the Affordable Care Act. In particular, he nixed a policy that gave uninsured adults in 36 states an extra 12 weeks to sign up for coverage. I believe that pertained to people who just lost their job through COBRA. He also reversed an order that included more outreach funding to states, which was designed to make Medicare stronger. Caroline Leavitt, Trump's press secretary, said, quote, "Trump is kind of wiping the slate clean." Leavitt concluded, "If you contrast day one of this Trump administration with the last one, it is a different approach to health care." So I will keep you up to date with all of this and more here on a daily basis. So share this video with your friends and family. Share this video on social media so more people can get this information. Make sure to subscribe down below and click the bell icon if you haven't yet so you don't miss out on future videos. It's completely free to do so. Click here to see the Fed's major announcement they just made, or click here to see Trump's executive order that goes into effect this week for millions of Americans. Thanks for watching, and I'll see you in the next video.